Our guest tonight is Dr. Elizabeth Owings, and she is going to continue the discussion that we've been having this week on the topic of autism. I am going to switch the screen control to her and tell you just a little bit about her. Dr. Elizabeth Owings is a medical doctor who has served as the Chief Surgical Resident at the University of Alabama, Birmingham, a Critical Care Fellow in the Department of Pediatric Surgery at Children's Memorial Hospital in Chicago, and a Pediatric Surgery Fellow at Cardinal Glennon Children's Hospital in St. Louis. Her research into the use of vitamins, minerals, and other natural remedies took her through tens of thousands of articles and published research paper, truly making her an expert on natural therapies. She's a delightful person to talk to. I actually love your Alabama accent, too, Elizabeth. So welcome. Are you there?
I am here. Can you hear me okay?
I can hear you perfectly.
All
right, so I'm handing it over to you.
Okay, thank you. I'd just like to flesh out the whole concept. I'm not an autism expert, but I was very recently at two major conferences. One of them was specifically about autism, and the other was actually my review course to maintain my pediatrics board certification. And there were two completely different, well, not completely different, but very different approaches in concepts about autism. And so I came away with that from both of them with this concept that there was something important that I had gleaned from it, and I wanted to share that with people. So that's the background. And hopefully maybe there's an autism expert out there who would like to redo this talk and do it better. That's fine with me. I have no ego attachment to this. I just want to share some of the information and some of the new concepts that I was presented with, and some of this information really got my attention. So let's see, off we go here. My objectives tonight are we're going to define autism, and I understand Dr. Dolan, made it clear some of these definitions are a little nebulous, and I understand that, but we're at least going to talk about that and talk about what the new paradigms are, because there are old ways of looking at things, or sort of more conventional medical ways of looking at things, and then there's some new things, new information and new ways of looking at it that may offer some management options that we might not otherwise consider. I'd like to share some resources. There's something called the Autism Research Institute, and they have a group called Defeat Autism Now, and this is where I got my what I consider my current up-to-date information about autism and management options. And I'd like to promote study. This is not a comprehensive overview. That would be impossible to do in 1 hour. There's just too much to say and to know about it. But hopefully, for the scientifically inclined, I'll present you with enough information. You'll develop some curiosity and go look for things yourself. And for people who aren't, doctors and nurses and scientists and whatnot, hopefully you'll come out of this, I think, with some hope, a lot of hope, because one of the, I think, things that conventional medicine doesn't necessarily do very well is provide a lot of hope. So one of the things I came out, especially from the Defeat Autism Now lectures with, and it was 2 days. It was 2 full days of serious science, and I'm going to try and distill that and make that understandable for people. But that's what I came out of that with, was there is hope. There's lots of hope. There are people who once were clearly autistic, and now you can't pick them out of a crowd. And that's a huge difference, and that's, I think, a very hopeful concept for people. So let's talk about paradigm shifts at first. And for those of you who were with me last week talking about nutrition in the brain, this slide may look familiar, and that's because I think the paradigm shift applies to autism as well as to anything else going on with the brain and anything else going on with the entire body. And you'll learn that, I'll talk about this, autism may not be just a brain disorder. It may be an entire body disorder that happens to show up in the way people behave. So the paradigm shift with regard to nutrition, when I was in medical school, we learned that the RDAs were set up based on deficiency states. And the RDAs were recommended daily allowance, and they've changed the name 12 times, but the concept is the same, that for 97% of those whose intake is less than the recommended daily allowance, they'll demonstrate a clinical deficiency. So if you give someone the RDA, then there's only a 3% chance that they'll have a clinical deficiency state. Well, that, to me, sort of begged the question, well, then there are people who are getting enough nutrition, yet they have a clinical deficiency. What's wrong with this picture? I hope someone's going to teach me to recognize these people. Of course, they didn't. The other question is, what about the subclinical states? What about people who don't have an obvious deficiency? For example, vitamin D, the obvious deficiency state is something called rickets. And that's why they started fortifying milk with vitamin D several decades ago, was to get rid of rickets. And we now, the cutting-edge thinkers in vitamin D think that there are a whole host of subclinical deficiency states, everything from type 1 diabetes to cancer to heart disease and blood pressure problems. They think all of these may be subclinical vitamin D deficient. Subclinical means the doctor doesn't recognize it, but yet it's a deficiency state. It's a situation where it could be optimized with more of that nutritive substance. The last thing you have to ask is, well, what if I'm in the 97% that gets enough, but I'm not absorbing it? So all these things play a role, and the shifting paradigm is we're coming from an illness and disease focus, I think, in forward-thinking physicians and clinicians. The illness focus or sick care, you may think of it, the concept is, well, you have a symptom and you need to fix that symptom. So if we can treat the cause, we will, but that actually presupposes that that we have a paradigm that includes what the cause actually is and what we can think about. And that's sort of a roundabout way to say that you'll never find a cause if you're not looking for it. And so when we're talking about autism, we're finding out there's not just one cause, but there may be many, many factors. So another thing that happens in sick care is we can turn a symptom into a disease. And it was a major shift in thinking for me when I stopped thinking of high blood pressure as a disease and started thinking of it as a symptom. When I started thinking of it as a symptom, then I could look for things the body might be lacking that might help that symptom disappear. So it's more of a restoration of health. You were going to say something?
No, I said that's a really powerful mindset about it. That's great.
Oh, absolutely, absolutely. And turning a symptom into a disease, good heavens, do you know at some of the psychiatric conventions, they actually have a show of hands. I mean, I have someone who has pick something, a fear of umbrellas. Anyone else have that? Okay, I think that should be a new clinical, entity. All right, and they may vote on it. I mean, that's where we are. And I think the empowerment comes becoming empowered to take care of ourselves and take care of our health really comes from saying, well, you know what, I'm going to see if there's something I can do about that rather than just name it. The other thing we find is that we've got, you may have a symptom, you may get a pill, and the pill may have side effects, and you may get another medication for that. It happens often enough that I think it's an issue. And I think a lot of people are now aware, and they go, well, doctor, if all you're going to do is give me a pill, I'll just live with the symptom. Maybe I'll just stay with the symptom until I can find some other solution. And I think that's reasonable. The new paradigm is give your body what it needs to function optimally. And what you need, Sherry, to function optimally may be different from what someone else needs. And we may have to figure that out individual by individual. You may not be able to treat an entire population like a herd of cattle and give them all the same thing. Some people may need more of this or that. And then there's a concept of good enough versus optimal. So the RDA sort of came from a good enough paradigm. And what we're looking at today is more of a wellness paradigm. And what we're looking at is people want to be optimal. They want optimal nutrition. They want optimal performance. They want an optimal workout. They want so we're looking at people getting higher doses than they may get just of certain nutrients than they may get just with a simple multivitamin. The wellness industry is, I think, what sprung out of some of these paradigm shifts. It's consumer-driven, and I'm grateful for that. And it's really focused on optimizing entire systems, detoxification system, antioxidant system, energy supply system. And it's not just blood flow, but cofactors and what's actually happening, on the molecular level in the body. and as well as the digestive system. We want to optimize it. We want a balance of good germs with unhealthy germs. We want to be able to absorb the nutrients that we're taking into our body. So a word about genetics. This slide may look familiar to you too, because I think it's important. Genome mapping is complete. We have completely mapped the genes, both chromosomes, the entire genome of one person, and we found a lot fewer genes than we expected. We were thinking maybe there were 200,000 genes. There are really only about 20,000. And there's a lot to this that's important. Actual genetic diseases are really quite rare. There are things we may have heard about: sickle cell anemia, cystic fibrosis, muscular dystrophy, hemochromatosis, which is people who have trouble with iron. They can't handle iron correctly, and they store it in the liver and pancreas, and it winds up damaging those organs. But they're actually fairly rare. And so what we're left with when someone says, well, I have this or that condition, don't you know it runs in the family, you have to be a little bit more open-minded about what does that really mean. Many of these things, there's maybe a genetic predisposition, but truthfully it's multifactorial. And since we know there are so much fewer genes than we thought in the first place, there's an entire new world opening up called epigenetics. And what that says is, hey, there are certain things that you do that turn on and off certain genes. And the better you take care of yourself, the more optimal that gene expression is going to be. So it's heavily influenced, we now know, by how you're exercising, by the things you're thinking, by your nutritional state, other health habits. And for more reading on that, which, I mean, it's extremely interesting stuff, because as far as I'm concerned, that changes everything. You can no longer say, well, it runs in the family, it's just going to happen to me. That's not true at all. Nothing, I can't say nothing, I guess. Never say never, right? Very little that's written in your genetic code is written in stone. You have predispositions. There may be a predisposition towards needing more of this or that nutrient, but it's not written in stone. And you don't have to suffer the consequences of the bad effects of that gene if you're taking the very best care of yourself. The last thing to think about is all the cells in your body have some turnover, even your heart cells. We for years believed that sort of the heart cells were kind of stable. You didn't really produce very many more. We now know that's not true either. It's slow, but even those cells turn over. And the estimates are, even the most conservative estimate is, you have a new body about every 10 years. And the things that you're doing for that body are going to affect the health tomorrow and next week and next year. So those are the things I wanted to start out talking about. A few disclaimers of my own. None of the statements that I'm about to make have been evaluated by the FDA. There are, a second thing to think about, there are some individuals that are going to have genetic syndromes that are associated with autism spectrum disorder. And you can't actually change your genes, but we can optimize the systems in the body that are expressing those genes, that are turning those genes on and off, and that are relying on those genes so they're making the proper protein. No one thing that I'm going to talk about should be considered a magic wand. It's not like, you change a diet tonight and tomorrow everything's better. Then there's no guarantee that any single change that people will make will yield results. So I don't have anyone in my family with autism, but I recognize many of the people that are on the call or they may have friends that have children with autism, or even adults who are somewhere on the autism spectrum disorder. So hopefully this is going to be useful information. Like I say, one of my objectives is to promote your curiosity so you'll even go and look and get more information. So the question I like to ask, I said, what does cutting-edge management of autism have to do with the rest of us? One of the things I came away from the Defeat Autism Now conference with is this concept of, why are there so many epidemics? There's an epidemic of melanoma, there's an epidemic of cancer, there's an epidemic of type 2 diabetes, and there's now an epidemic of autism. When I was doing my pediatrics training in the early 1990s, I think that the numbers were something like 1 in 400. And now the estimates are something like 1 in 150. And I'm not going to get into an argument about, are we better at diagnosing, or have we shifted the bar so now people that we used to just think were ADHD, now we're going to call them autistic. That's not what this talk is about. This talk is, what can we do what things can we do that's going to help not only the child with autism, but actually all of us. So why is there an epidemic in all these things? Is it genetics? Well, I don't think the entire gene pool has changed in a generation. But I think there are significant lifestyle issues. And when you look at it from a systems approach, there may be several contributing factors, and I'll get to the punchline at the end here. Autism itself is basically a constellation of findings characterized. You've got impaired social interaction, you've got impaired communication, restricted and repetitive behavior, and usually without a clearly defined etiology, or I should say there's no one thing that we can point to that causes every incidence of autism. The severity of autism is going to vary. The severity of these symptoms is going to vary from person to person, to the extent that instead of talking about autism or Asperger or pervasive developmental delay, that's what that PDD is, we just sort of put it all together and say that they're on the spectrum, autism spectrum disorder. Some findings, there may be poor eye contact, they may not respond to name, typically there's late language development. There's no true play typically. They may stack items up or line them up, but that's sort of a repetitive stylized behavior. They may be especially good at certain things. Some have particular aptitude at mathematics. There may be situations with poor sleep. They may have self-stimulatory behavior. They call it stimming. Actually, I had to look that up on Google. They never defined that one for me, so I had to figure that one out myself. Self-stimulatory behavior. It may be head banging. It may be door slamming. It may be they may even injure themselves, and it may last for hours. So there's a lot of, you can see if you put these things together, the stress on a family. I mean, you've got a child that is not able to follow commands or doesn't necessarily obey commands, so you're concerned about safety. They're not sleeping, which means probably mom isn't sleeping either, or maybe dad isn't sleeping either. They've got this, these behaviors. There's a degree of social isolation. Can you take your child out to dinner? No, no, you may not be able to go out to dinner. And so these things, add up, and it can be extremely stressful for a family. Now, I'd like to make a few analogies, because autism, you'll discover from the definition, it describes what the person acts like, but not why. It's like saying the refrigerator doesn't work, but there could be a half a dozen reasons why it doesn't work. It may not be plugged in. The circuit may have blown. It may not even be a refrigerator, maybe an ice box, and you have to go get ice and put ice in it. So there are 1,000 different reasons the refrigerator may not work. It's as specific. Saying someone has autism is as specific as saying they have gray hair. There are actually a lot of reasons to have gray hair. You may not have known this, Sherry. I don't know if you have gray hair, but you might be interested. I don't know. There may be there may not be enough minerals in the diet or in the body. Excuse me. There may be damage to the cells that make the pigment for the hair, and that's probably the most common as we get older. That they've now decided that it is probably damage to those pigment cells. Or some people, after they have a fungal infection in their scalp, they may have an area where the hair does not have pigment. It appears gray. Another, if you get a chance, this is sort of fun, go to Google Images and Google white forelock. There's actually a genetic condition that causes people to have a white forelock, and it's associated with deafness. It was all the rage for a while. It seemed like everyone was dyeing their forelock white, and I was confused. I thought they were deaf, but no. Fortunately, I think that's fallen out of favor. No one's doing that much anymore.
I think it's purple now usually.
What's that?
It's usually purple now.
Yeah, no, there's no genetic syndrome with purple forelock. No. So when we study diseases, we may study one particular attribute or try to change only one variable, and then we're looking for some statistical significance in the outcome. And I call it the Betty Crocker test kitchen. We're gonna bake 2 cakes, and we're going to change one thing and see which cake we like better. And it's good science, but it's based on an old paradigm. If you believe there's only one thing that causes autism, then doing things like that would make sense. But it may be invalid to take all autistic persons as an entire group. And the reason is autism is describing the behaviors, but the contributing factors are multiple and myriad. So it's like managing autism is sort of like, say, I'm going to give you an analogy of something that's really sounds quite silly. Let's suppose I'm a trauma surgeon, which I've done a lot of trauma training, so it's not a stretch. And I discovered that a lot of my patients can't walk. And I want to do a study and say, why can't they walk? Well, look, maybe they have a hip fracture. So I'm going to do a study. I'm going to take all my trauma patients and divide them into two groups. I'm going to pin one group, but I'm not going to pin the other. And then I'm going to see who, if I can find a statistically significant difference in the ability to walk at the end of a, determined, number of patients or something. Now, you notice I never said I was going to x-ray the hip. Mm-hmm. So it's kind of ridiculous, isn't it? It's ridiculous because regarding trauma, we've got technology. We can determine exactly what the injuries are, and we can manage those injuries specifically. There are several reasons someone may not be walking, and they're very different. Yes, they may have a broken bone or a knee injury, but they may have a spinal cord injury. They may have a brain injury. They may be in a coma. So whereas every trauma patient is different, we treat the patient. We don't treat the wreck. We don't go out and look and say, well, oh, there's a wreck. Let's see. They might have this problem or that problem. You treat the patient.
Right. Elizabeth, so, I was going to mention Dr. Dolan is also on the webinar, and she just typed in and said she was on as well, so I unmuted her. So we have her on the line too.
Oh, wow. Okay, great.
Dr. Dolan, are you there?
I'm here, and I don't want to break up the flow here. This is very fascinating, so please continue, but if you don't mind, I'll throw a question in here and there.
Absolutely.
Okay.
Thank you.
Right. Keep me hopping. Now, look, I'm not an autism expert, so you can't ask me anything hard.
All right, agreed.
Okay. Now, so my point is, when we're talking about people with autism, we do actually, in fact, have the technology to determine what systems may be working poorly and to optimize those systems for the people with autism spectrum disorder. And hopefully my analogies made sense. So there are two models of autism. We've got sort of an older model. This is a little bit more of a conventional medical model that says, well, it's probably genetic, it's a brain problem, it's hardwired, and you can treat certain things, but you can't really hope for recovery. And the newer model is saying, well, there may be an environmental trigger of some genetic predisposition. There's a brain component, but there's a body component too. There are metabolic abnormalities, and this is something that's treatable, and there are people who are recovering from this. So the balance is, well, is this a brain disorder, or is this a disorder that affects the brain? So if we look at standard autism treatment, conventional medicine, there are behavioral therapies, and they're extremely important. Social skills training, also very important. Educational intervention, how are they going to learn? They may need special services just to, if they're capable of going through education in the classroom, they may need special help too. The parents have to be educated. There's even a move towards, as they're getting older, they may need individual psychotherapy because they're socially handicapped. They're not making eye contact. They may not be making friends. And there's also standard medical therapy. If they've got seizures or infections, you're just going to treat that like any other patient. They've got to be managed. Now, a somewhat new systems approach. You may have learned about the systems in the body, and you were used to thinking about something you could put your hand on, the circulation system, and you could think, well, I can put my finger on my pulse, and I can feel the circulation system, respiratory system. Oh, okay, that's my lungs and my trachea. The digestive system. Okay, those are the intestines. I can understand that. Musculoskeletal. Again, you put your hand on that. The new paradigm is looking at things really from a much more, to me, functional level. It's not just where the organ is, but everything that has to go on within that organ. Those things happen at the cellular level, and they happen at the molecular level. So we find that in the new paradigm, we're looking at the antioxidant system, the detox system, the mitochondrial system, and I'll describe what that is later, and even cellular respiration. And the new paradigm is saying, look, for the entire body, let's take away what's harmful, let's replenish what's missing, and let's repair what's damaged. And we'll come back to that several times again. The cutting-edge concept in autism is that this is a multi-system malfunction. The immune system is messed up. There's inflammation. There's poor germ fighting. There may even be antibodies to the brain, and this may be present from before birth. These may be present from the mother, okay? So this is a long-standing problem. This concept that it happens all at once is probably not true. There's probably a situation where there's been a gradual buildup of things, and suddenly maybe the straw that broke the camel's back. The antioxidant system, it can't keep the body's systems working without proper antioxidants. Sure, there's a lot of background noise, so I'm not sure if we may need to mute out one of the other open lines.
Okay. That's the only other open line is Dr. Dolan's.
Okay. It sounds like someone's moving furniture, at least from where I'm sitting. All right, another cutting-edge concept. We've got the metabolic energy system. Without the energy at the molecular level, the cellular level, to these vital systems, we're going to build up toxic metabolites. The system can't work. The detoxification system. This may be overwhelmed by toxins. This may have begun from before birth. The digestive system, we may be getting poor nutrient absorption, the wrong nutrients. We've got a poor balance of good germs and bad germs, a little oversimplified, but it works. Toxins are flooding in. The digestive system is actually promoting inflammation through all this. With all these systems messed up, the brain does not stand a chance. And it may not be actually all of them, but there's almost certainly more than one because they will play off each other, and I'll describe that a little bit more. So what's the management, the cutting-edge management? Pharmaceuticals play a supporting role. I don't know if you knew this. There's only one FDA-approved medication for the treatment of autism. Risperdal is FDA-approved for the treatment of the irritability, tantrums, aggression, and moodiness associated with autism. But we're basically never going to find a pharmaceutical cure for autism because no one thing causes autism. But we can treat the contributing factors. What I noticed is the people that seem to have the most improvement and the most success were almost undergoing an entire lifestyle change for just a completely different focus. They were eating different foods. They were emphasizing different things. They were looking at, say, paying particular attention, I guess, to the balance of those germs in the digestive tract, for example. And people might do things that seem as unrelated as changing the way they manage the lawn because of weed killers and pesticides that they may be putting on the lawn may actually be stressing the system of the child that's trying to detoxify those things that it's been exposed to. They may change the water in the swimming pool, go from a chlorine system to a saltwater system. And every now and then you'll hear about someone who said, wow, we changed the water in the pool and that's what did it. Suddenly everything got better. I don't know that you can say that that's what did it, but you know that when you put all these things together and there's a cumulative beneficial effect, then you may have trouble picking one thing out. But when they're getting benefit, who cares what it took? I mean, it's priceless when you've got somebody that wasn't speaking and now is. Cutting-edge management, there's got to be behavioral and neurologic mandatory. That's mandatory. But what else can we do? Immune system support, gastrointestinal support, support these antioxidant and detoxification systems, and support the mitochondria. Again, I'll describe what that is when we get there. So the behavioral therapies and neurologic behavior, this is interesting. This is a useful analogy I got from my pediatric review course. Someone said, look, if you've got autism, it's like, say most people who don't have autism were sort of loaded with a Windows operating system. And it does a lot of things on its own. It's got a bunch of programs already loaded into it. It can figure out your preferences. It can save your passwords for you. It's a pretty advanced system that kind of runs itself versus DOS. And anyone who was doing computers 30 years ago remembers DOS and Lotus and these very basic systems. You had to tell the computer to do every single thing you wanted it to do. It did almost nothing on its own. And that's the analogy that I used. With autism, since they're not picking up social cues, they're not learning these things, you actually have to teach them all these individual social cues. You have to teach them how to play. A very interesting talk was given by someone who delineated out about 19 different stages of play, everything from putting a ball in a cup, all the way up through, say, picking up a toy and giving it a personality and having it talk. You can't jump from one to the other. And in autism, you may actually have to teach them how to go to the very next step. And when you do these things in sequence, then they are able to do this, learn how to play like we're accustomed to seeing children play. They need social skills training, education, intervention. Parents are always going to have to be educated, and the more they know, typically the better. And obviously, we still have the standard medical therapy for seizures and infections. Now let's talk about the immune system. First, I have to describe the immune system to you. Then I can tell you what's wrong in autism spectrum, and then we can talk about how to make it better. The immune system, think of this like an army. And a healthy immune system should work like a well-run army. It should recognize foreign invaders. It should kill them quickly and efficiently. And it should remember enemies so that it can prevent future attacks. And lastly, you know what friendly fire is? That's when you get killed by your own troops, okay? No friendly fire in a healthy immune system, so it's not going to damage the self. There are some players here, and I'm going to describe these because it's worth getting a good enough understanding of the immune system so you can understand how these things can be messed up and can work better. There are these things called antibodies, and what these are identifier proteins, and they attach a flag to a foreign invader, hopefully a foreign invader. And this is so the cells, you can think of the cells as soldiers, can actually see the foreign invader. See, the soldiers do not know who to attack or who to kill until a flag has been attached. There's something called cytokines, and these are basically orders, just like any orders you would get in an army. There's orders called come and fight. There's another order, continue to fight. And there's another order, very important, the stand down, sort of an at ease order, stop fighting. Very important order, and this seems to be very challenged in some of the people with autism spectrum disorder. The last thing that's really cool is this concept of proliferation. And basically, if a soldier finds that he's really well adapted to kill some invader that's got a certain kind of flag, he can become an entire troop. So these are just useful concepts to understand the immune system. And just if you want to talk about immunizations, we can walk our way through it. You say tetanus is still probably a leading killer worldwide, and we get vaccinated from it from very young because we need that to be able to fight that off. Tetanus is everywhere. It's absolutely everywhere. It's in the soil. It's everywhere. So when you get a vaccine, it gives you a little bit of that something so your body can react to it and start making these flags. And so that if you ever are exposed to that germ, to that foreign invader, your soldiers will say, hey, a flag is stuck to that. That must be something I need to destroy. So the soldier will destroy it. And it usually, these soldiers can even become troops and say, hey, we've got an invasion by something that wears this kind of flag. So let's make a troop and let's take care of this infection. And that's the idea there. In autism spectrum disorder, the immune system is not adequately recognizing foreign invaders. People may have chronic infections. They may be bacterial, they may be parasite, they may be viral, a virus. It's not killing these things efficiently. The soldiers are distracted. They seem to be distracted doing other things like fighting the body itself. There's a poor immune response to infections and vaccines. It's not remembering. So even though you got an immunization, it's not able to either mount the proper response to that immunization, and it's certain when it's confronted with the germ, it doesn't recognize it, doesn't remember. And it is, in fact, damaging the self. We've got autoimmune problems, so there's lots of friendly fire in what gets attacked, all kinds of tissues, but most notably the brain. So in autism spectrum, the immune cells are having a poor function. Lots of orders are flying out there, but they may be conflicting. Fight this, fight that, fight the self. Infections are able to thrive in this chaos, and even the infections can produce toxins and damage tissues, and they can even drive inflammation, but it's not inflammation against the infecting agent. So that's kind of the system there. You can see how things are messed up. So what are some clues that someone may have immune dysfunction, or that the immune system's not working right? Rashes, big time. Eczema, dark circles under the eyes. We call those, doctors will call those allergic shiners. You know, if somebody hits you in the eye and you get that big bruise, we call that a shiner. But, you know, in people with allergies and immune problems, they may have what we call allergic shiners. They may have lots of allergic rhinitis. That's the runny nose you get from allergies. They may have asthma, lots of trouble with warts. That's an immune system problem. You see, not everybody has warts. It's the people with an immune system that's challenged that are developing the warts. Molluscum contagiosum, that's a special kind of rash. There's not really a treatment for it, but usually, fortunately, it goes away on its own. Well, but it's a clue that the immune system isn't working well. Herpes or other viruses that are thriving. You know, if you've got someone that's got frequent cold sores, frequent canker sores, which is not exactly herpes, but those are all going to suggest that this is an immune system that's not working well. Thrush or other candida reactions or candida infections, that's suggesting the immune system isn't working well. So I know this is busy. What I want you to get from this is we've got our soldiers, we've got these flags, we've got these fight orders or stand-down orders, and the key is all these are fight or come and fight or continue to fight orders. And these are the stand-down orders. And what we know about autism spectrum is there's not enough stand-down. There's just this chaos of inflammation, and it's not even working against the germs that may be attacking the body. It may be working against the body itself. So this is interesting. Remember I said it's multifactorial, and the immune system, I think, is where it starts. You may find, a family history of autoimmune problems, type 1 diabetes, thyroid disease, Graves' disease. Another one, mother-head infertility. A very interesting statement that was made during all these lectures is that the very first sign that a baby may or a child may have trouble with autism is mom came in for an infertility workup. Fertility is a situation where the body has to, it has to accommodate something that is actually foreign to it. I mean, the baby has a completely different set of genes, but the mother's body has to be able to accommodate that, or, it's attacked like foreign tissue. So you have to ask yourself, is these immune problems, that's one potential immune problem. Another problem, mom may have had infertility because she is so overwhelmed with her own toxins, the body can't actually handle a pregnancy. Another multifactorial immune system clue, the mothers may have antibodies to fetal brain. And this is very interesting. One of the studies, they took these antibodies and injected them in, I believe it was a primate model. And then they had a control group. They had, another set that didn't have antibodies to fetal brain. And they injected antibodies into two groups of monkeys, and they found the one that had the antibodies to fetal brain began to have stereotypical behaviors that we expect from people with autism. So it's a very interesting connection there. Also, people with autism spectrum disorder are more likely to have antibodies to brain proteins than people without. Now, this, to me, begs the question, well, if both of them may have antibodies to brain, those are those flags that say attack brain, attack the brain tissue, why doesn't everybody have autism spectrum disorder? And to me, the answer is this is a multifactorial, there's no single cause. We've got multiple things building up and multiple interactions. Other clues that the immune system is very much involved in autism spectrum. They may have improvement during fevers. So the immune system is giving an order to raise the temperature, and for some reason, one of the other things that happens when the temperature is raised is they tend to get better, which means there's less inflammation, or less, let's say, less of these messages attacking the brain. That's the easiest way to understand it, I think. So we've got overactive inflammation. There's no regulation of that inflammation. They also may be reacting to foods and allergens that may get worse when they've got been exposed to allergens. Sorry. Now, this is very interesting to me. I didn't know this. there are maybe completely abnormal immune responses. For example, they may get a measles vaccine, and they may not develop immunity to that measles vaccine. Not only that, since it's a live virus, you can actually measure measles vaccine in some of these kids. So that's, what that says is the immune system is not working correctly. Not only that, strep, we've all heard of strep throat. We probably all had it. They will not have the proper immune reaction to strep. In fact, this ASO is something that we expect whenever people have strep. They won't have it. Theirs may be negative. And, well, you say, well, then it wasn't really strep infection. Well, it is if you culture strep from their throat, yet there's no record of it in the immune system. So all these things are things to consider. We've got high levels of inflammation, lots of flags out here, no stand-down orders, low levels of the anti-inflammatory, no stand-down orders, low levels of barrier flags. Now, this is a particular kind of antibody that's secreted in the digestive tract and say from the eyes and in the nose from the mucosal elements. They don't have enough of that, so the germs can actually have a field day because there's nothing to fight them off. And there are low levels of the memory flag. IgG is the one that helps your body remember what you've been exposed to before so you can fight it off next time. They don't have enough flags. They're not making these flags. So we mentioned immune globulin. Actually, the flags may be so low you can get insurance to pay for injections. Immunoglobulins is what you would give. That's how low they are. Viral titers may be positive. I mentioned that. Vaccine titers may be undetectable. And there may be autoantibodies. So those are flags to the tissue, to the body itself. Thyroid, vascular, brain. Lyme testing is Lyme disease is common enough. I think if there's any suggestion, many practitioners are advocating looking for Lyme disease. So what are we going to do? And this is, remember I said let's get away from what's hurting us. Let's replenish what we're missing and repair what's damaged. So the things we're going to try and get away from is anything that triggers the allergic response, not only in the diet but anywhere else in life. Casein and gluten, you may have heard of a gluten-free diet or casein-free, gluten-free. Casein is the protein that we find in milk and cheese. Gluten is what we find in wheat and other grains. And I'll talk a little bit about why that may be helpful in a minute. In my little section on the digestive system. But if you're going to go casein-free and gluten-free, you may as well avoid soy because there's a 15% cross-reactivity with casein. Anytime you're going to undergo a dietary change, the recommendation is to give it at least 6 months to see if it's going to make a difference. And it has to be complete. If you're going to go casein-free, gluten-free, soy-free, you have to completely avoid it. So if you're going to do it, you're going to go all out, then go ahead and plan it. And that's why I say people may have to make complete lifestyle changes in order to get improvement for the person they're working with. Phenols I'll talk about a little bit. Additives, some of these additives are actually mimic neurotransmitters in your brain and may alter behavior even in otherwise normal people. Another thing to avoid sugar. When we're talking about the immune system, sugar directly blocks those soldiers' ability to make a troop. Sugar directly blocks it. It limits the come and fight order. So even though there's an invader, even though there's a soldier there, he tries to give a come and fight message, nobody comes because he can't make the message. And it actually limits the ability to get to the fight. We want to begin to heal things we can. It's going to involve antioxidants. I'll talk about those, other nutrients, essential fatty acids, immunotherapy, that's that immunoglobulin, and possibly even hyperbaric oxygen. I want to talk about this just a second. Hyperbaric oxygen, we're not talking about a diving chamber. We're talking about 1.3 atmospheres, okay? Just a little bit increased pressure and partial pressure of oxygen. And what this does is help the body, it sort of forces the body to make its own antioxidants. And your body does have its own antioxidants. But that triggers the body to make more of them. So that's a very useful thing when we're trying to help heal the body and replenish these systems. The other thing it does it involves the mitochondria. It actually, if there are mitochondria that are damaged, it goes ahead and destroys them, but you make more. And what you make, the new ones are going to be much healthier than the old worn-out ones were. Now, vitamin D, you have to understand this. Deficiencies are the norm. Most people are vitamin D deficient, and people with autism are certainly no exception. They're not out, typically not out in the sun. They may be socially isolated, so they may not be getting out much at all. So I say work towards a level 55 to 70, because this actually is going to help upregulate this cathelicidin family of genes. What those genes are, these are genes. Remember, this is important stuff. This family of genes is a natural internal antibiotic. Your body makes its own antibiotic, but it cannot do it without that vitamin D. So other basic interventions. You need to treat the underlying problems. If you've got the wrong germs growing, more bad germs than good germs, you've got to restore the good germs. Inflammation, there are even anti-inflammatories to take. And detoxification, we've got to optimize the detoxification system. Last thing, don't stress the immune system. Let's give smart immunizations. Even the AAP says not in sick children. Now, their definition of sick children may be different than the standard mothers. They consider that upper respiratory infections, most ear infections, colds, and diarrhea are not a reason to delay vaccinations. I don't know that that's true or not. There are enough case histories of people going in for vaccinations, a child that was functioning, going in for vaccinations, and on the other side of those vaccinations being a completely different person, that I've begun to wonder if there isn't some association. Is vaccines all it takes? No. These children probably are not normal from before birth. This may be the straw that broke the camel's back. Now, one of the other things that we do when we're giving vaccines that may be a contributing factor is we give them acetaminophen, which is directly toxic to the liver. We know that. And pediatric liver failure, liver toxicity due to acetaminophen is not just for a kid who eats a bottle of Tylenol. This happens, and the children seem to be more sensitive to it even than adults are. What do we do? Before we give an immunization, we give something that's going to limit the body's ability to detoxify anything that it's been presented with in the vaccination itself. So these are all things to think about. N-acetylcysteine may actually help support the liver function so that it can detoxify the acetaminophen, and coenzyme Q10 are things to think about giving if you're going to give acetaminophen as well. So the other thing you have to know about the immune system is that the largest immune organ in the entire body is the intestinal tract. The gut is absolutely the most important, the biggest immune organ in the body. It's got 10 to the 12th cells. That's 1 quadrillion lymph cells. And the next thing to understand is there are 10 times more bacterial cells in your intestinal tract than there are cells in the human body. So you take all the cells in the human body, excuse me, multiply that by 10, and you've got the number of bacteria living in you. And they're not bad bugs. They're there for a purpose. They play a vital role in the immune development and immune function. But there are things that we do that change the balance. If you've ever been on antibiotics, you've changed the balance of germs in your entire intestinal tract. If you take antacids, you've changed the balance in your entire intestinal tract. Many of these, the reflux medications that are out there now are, the idea is, well, let's at least, if they're going to have reflux, let's at least make it so it's not acidic. You've changed the germs that are growing in the intestinal tract, and therefore you've changed the immune system. Now, we all know the digestive system. Its job is to digest food. It's going to absorb nutrients. It should excrete toxins and waste products, and it should block the bad germs from coming in to the body as a whole. That's where those barrier flags come in, so your body can recognize them and block these things from coming in. So when the intestinal tract isn't working, it's an entire vicious cycle of problems. The food isn't digested well. It's not absorbed well. You may be absorbing large food particles, and this contributes to food sensitivities, which contributes to gut inflammation, which contributes to leaky gut, meaning you're absorbing things you shouldn't be absorbing at all. You never should absorb that. which goes back and feeds into poor digestion, poor malabsorption, absorbing the large food particles, more inflammation, around we go. Constipation may contribute to absorbing the toxins and bacterial products because it's just sitting there in this big leaky gut. And diarrhea is going to contribute to malabsorption. And it can even suggest that there are too many bad germs, or what we call dysbiosis. So what are some clues? There are lots of them. These children may have had breastfeeding problems, persistent colic beyond 6 months, reflux, food sensitivities, failure to thrive, frequent antibiotics. We're going to change the germs that are living there if you take a lot of antibiotics. Other clues, there may be probing or hands in the pants. They may even have self-injurious behaviors. They may throw themselves against the arm of a chair 150 times in a row, landing on their abdomen every time. If they can't talk to us, they can't tell us they're in pain. I mean, they may be experiencing something, and that's the only way that they can let us know something's going on. And the last clue may be poor sleep. There may be abnormal stools. The buttocks themselves may be wasted and not full. The abdomen may look bloated and puffy. It may, for a clinician examining, it may feel doughy, and which would suggest yeast. And there are findings of gastritis, duodenitis, colitis. Basically, this is an inflamed intestinal tract. 36 subjects underwent endoscopy. These were patients with autism spectrum disorder. 69% had reflux esophagitis. That means the esophagus had lots of erosions and was inflamed because of acid going up into the esophagus. That's the swallowing tube. 42% had chronic inflammation of the stomach. None of them had the germ, that H. pylori is the germ that's associated with ulcers. None of them had H. pylori. But 2/3 of them had chronic inflammation of the first part of the small intestine. So this inflammation situation is very common. Now, this is a busy slide. Just look at the yellow parts, okay? Any scientist out there can read all the rest of it. Most people just look at the yellow parts. Basically, what we're finding is there's going to be poor absorption of vitamin B12 and many other nutrients that are absorbed in certain parts of the intestines. They've got decreased enzyme production. How are you going to digest your food if you're not producing the proper enzymes? And all of this contributes to this chronic, or suggests a chronic inflammatory condition. What is this dysbiosis? That's the wrong germ situation. Okay, we've got too much of the wrong stuff. And your intestinal tract holds 400 or 500 different kinds of germs. And some of them are helpful and beneficial, and some of them can be harmful. Yeast infections is something, again, that turns out to be fairly common. And if it's living in the intestinal tract and it's not causing symptoms that we're accustomed to looking for, your doctor may not diagnose it. This is one of the things you have to think about it and be looking for it. There may be rashes. Their feet may be peeling. The nails may be discolored, or there may be ridges. The anus may be red, or the cheeks may be discolored. Ringworm is another. I should have had another heading there, but that's another clue that there are things going on there, not just the immune system's messed up, but you've got the wrong germs living in that body. Now, the CDC, Centers for Disease Control and Prevention, says 70% of us have parasites. 70%. Less than 10% of us will get treated because most of us don't have symptoms, or we don't have symptoms that our doctors pick up on are associated with parasites. Things that the autism patients may have, anal itching or probing. Other things to think about, giardia. Boy, giardia is common. This is another parasite. It's in 2% of the general population. 25% of children may have giardia, and up to 50% if they go to daycare. And the symptoms that they have is, well, they may have no symptoms at all, and obviously it's going to be hard to diagnose then, but diarrhea and vomiting may be intermittent and long-term. You will have giardia in your system until you take the medication to kill that germ. That's one that you don't really clear spontaneously. It's not like a virus where eventually you usually get rid of it. This is one that you have until you take the right medication. Strep, a system that has too much strep in the intestinal tract, they may actually have bloody stools. Now, bloody stools could also be due to getting a protein that they can't handle, Some people that are allergic to casein, your first clue is that they develop bloody stools. So, but that may be a clue for strep. And this is a situation, again, this doesn't clear on its own. A person whose immune system and intestines are so challenged that they develop an overgrowth of strep, they typically aren't going to clear on their own. You're probably going to have to treat that specifically with antibiotics and then make sure you're replenishing the good germs that you want to live there. Clostridium, clues you may have that Clostridium is active. They may actually have stool smearing that may stop when you treat the Clostridium. But most common symptom is going to be diarrhea for that. Now, you may listen to all this list and you say, well, now, how am I supposed to know which one I've got? This is why you need a clinician that knows what to look for and knows what kinds of findings go together for this or that particular problem. I should have put that as a disclaimer at the very beginning. You're not going to listen to this lecture and suddenly know how to fix autism in every person that comes your way, because they're all different, and you have to really figure it out. It takes frequently an astute parent or caregiver and an astute doctor to find the right things to do for people. Now, some clues to malabsorption. Zinc is usually low in these kids. They may have frequent infections, white spots on the nails, canker sores. It's another clue from the immune system. Essential fatty acid deficiency. These kids may have dry, coarse hair and very common fungal scalp infections. Mom may be distressed that the cradle cap is still going on, even though the cradle was left a long time ago. That could be essential fatty acid deficiency. Magnesium deficiency. These kids may be sighing a lot. They may seem to crave salt, muscle twitches, tingling. They may be extremely ticklish. Low magnesium is like a nerve irritant. It irritates the nerves. And even in adults, we know low magnesium may be associated with everything from headaches to PMS to blood pressure problems. And it seems to be primarily because of this nerve association. Your nerves need it. So I just wanted to talk about some of these special diets and why it might make a difference for people. Gluten sensitivity. So where do we find gluten? If we're going to get a gluten-free diet, which we have to know what to avoid. Wheat, barley, rye, and oats. But you find it in all sorts of things. It's in Play-Doh. It's in, for the people that have chosen to avoid gluten, it's a real lifestyle change. But what's some evidence? Digestion of gluten and casein, that's the one that we find in milk, makes something called exorphins. Now, the orphan part may sound like morphine, and they are related. Your body makes things, you may recognize this word a little bit better, endorphin. That's what gives us the runner's high, and that's just basically our own little sort of internal morphine that makes us feel very, very happy and very high and very good. But these exorphins may cross the blood-brain barrier, and they don't do things we want to do, okay? Excess exorphins, if we give these to animals, it may induce rage or even catatonia. Catatonia is when you lay there, you stare off into space, you don't talk, you don't do anything. And so we can actually create that situation in animals with these exorphins. It's going to compete with the endorphins, those are the ones in our brain that are, sort of the good guys, and they can cause mood disturbances and other mental symptoms. When we're digesting this gluten and casein, it may produce proline, leucine, and glycine, that string, which may stimulate dopamine activity in the brain and even cause EEG changes. Now, if you've heard all this, and the scientists out there may be going, well, gee, if we block the morphine, that morphine receptor, might that be helpful? And that's this naltrexone here. That's something that's going to block that morphine receptor. And the answer is yes, sometimes it is. There are some people for whom low-dose naltrexone is a very good option. Again, that's for a clinician to decide. Now, gliadin is part of gluten, and we actually can form a flag or an antibody to this gliadin. And you find that in up to 87% of autistics. If they've got a flag to this gliadin, they're probably going to be well served by avoiding the gluten. These antibodies are very important, and there's a whole concept. There are people that are, people sort of looking outside the box and pushing the envelope are the ones saying, well, look, gluten sensitivity may be an entire neurological illness. There's something called SPRU, which an adult doctor would recognize as a gluten sensitivity, but there's some people who don't have any intestinal findings at all. All they have are neuropsychiatric problems, and they seem to be having antibodies to brain tissue as well. Another thing people may choose to avoid are phenols. These are, I should have probably put where they're found first. Food dyes, number one, tomatoes, peanuts, strawberries, red grapes, apples, bananas, orange, cocoa, and milk. And the Feingold diet is one example of a diet where you're going to be avoiding all these things. But what's the point? Well, there's an enzyme called phenol sulfotransferase. Let's abbreviate that one, PST. Its job is to break down excess neurotransmitters. Now, if you were on my talk last week when we talked about neurotransmitters or nutrition in the brain, there's always a building up system, there's always a breakdown system, and when things get out of whack or they're altered, one of those systems is inappropriately overactive, the brain is not going to function correctly. Another thing that this enzyme does is convert sulfite to sulfate. And if the sulfite is allowed to build up, then the immune tolerance is disturbed. Basically, that's going to promote that friendly fire situation. Another thing, you could have a deficiency in this enzyme, and actually the genetics deficiency is rare, but substandard function is going to be common in autism, schizophrenia, inflammatory bowel, migraine, asthma. So this is a situation where, okay, they may not have that deficiency, but this is another situation where we can optimize what we're putting into the body so we don't stress it. Now, the people may have, with trouble, sensitivity to phenols, may have red face, red ears, dark circles under the eyes, night waking, difficulty falling asleep, hyperactivity, aggressive behavior. So this is the kind of person that you might think, I wonder if we need to avoid the phenols and see if that's beneficial. Now, and when we talk about replenishing or promoting the good germs in the intestine, there's been a lot of study done on this big, long word, Saccharomyces boulardii. So Dr. Henri Boulard, in 1923, noticed that the natives where he was were eating lychee and mangosteen, chewing on the fruit and the skin in particular to fight cholera. And he isolated the germ that they were actually getting into their system. It's a yeast, but it's not. It doesn't cause disease. It's not absorbed into the system. It does all sorts of good things. It's going to degrade some of the toxins that some of the bad germs may make. It may protect against, infections with E. coli and salmonella. It helps to normalize a leaky gut, and it actually is going to promote these stand-down orders here. Okay, the stand-down order, this interleukin 10, that's your stand-down. It's going to promote that, and it's going to reduce all these fight orders. It helps feed the gut cells and increases the enzyme production. And it actually is going to help the intestine produce more of this barrier flag that's secreted in the gut itself. So this is something that people may choose to add in to supplement for the children who've got autism in order to help normalize what's living there. So your basic interventions, if you've got gut dysfunction, we're going to avoid allergens. If they've got specific foods, definitely that would be something to avoid. Now, if you do allergy testing, one of the things I learned is you may find they're actually allergic to almost every food. So you can't avoid everything. And one of the clinicians strongly recommended rotating the diet, where, yeah, all right, I recognize you're allergic to everything, but we're going to give you a little of this. At least on a weekly basis, we're going to change, and you're not going to get that food anymore. So that way you aren't reinforcing the allergy to that food. You'll move to a different food. Yes, there may be some mild allergy to it, but you're only going to eat it for a day or for a week. So they're going to rotate these foods. You may, again, do the casein, gluten, and soy-free diet. Remember, the soy is going to react with casein. So if you're going to exclude one, you may as well exclude all of them. You may avoid phenols, additives, and sugar. And invariably, someone will say, yeah, but you're telling me that I mean, all he does is drink milk. That's all I can get him to eat. Or all he'll eat is cheese. Or all he'll eat is strawberry frosted Pop-Tarts, which is sugar, white flour, additives, preservatives, colors, and gluten. So this is where, I think it's a tough situation to be in, but people have to make a decision. If you evaluate the information, you decide that's the best thing, that's going to be the best thing for your kid. People have gotten through it, and it's important to decide, what's the most important thing, a long-term benefit or the short-term comfort. If you're confronted with a child who won't eat what you put in front of him, sometimes I think you have to empower people to say, it's okay not to give him any other food until the next meal. It's okay if he misses a meal. It's even okay if he misses 2 meals. For most kids who aren't diabetic, they'll be okay. Third meal comes around, they're hungry, and they will probably eat whatever you give them. And then again, you look at the list of what you're supposed to avoid, and you find yourself going, well, what can I feed the child? And the answer is, go back to your meat and vegetables. Those don't tend to have gluten or casein or, phenols for the most part. So it's okay to go back to meat and vegetables. People do just fine and never eat bread. So you won't die if you leave off the bread. So those are things to keep in mind. You're going to need to supply enzymes for improved food breakdown. And do remember one thing. They'll tell you plant-derived on the little bottle of enzymes, but remember, that actually means that it came from yeast. If you've got someone who is sensitive to yeast, you may need to use other forms of enzymes. For example, most of the bromelain is going to come from papayas, so you may be having to optimize the enzymes that you're getting from natural foods. We want to begin to heal things. Again, antioxidants, nutrients, essential fatty acids. Give the nutrients, zinc in particular, vitamins. Treat inflammation. And this may be where medication is going to come in and become very important. There was even one physician who would give a trial of steroids to just a steroid taper, maybe over a couple of weeks, and see if there was a benefit and see if the child improved. Frequently they did, and he said, okay, this is an overactive immune system. When I give them steroids, they get better, so we're going to decrease the immune system. And remember, the largest immune organ is the gut. So that was a key to what he was doing with his patients. You want to treat the dysbiosis. You're going to supply probiotics. I probably didn't talk nearly enough about this. 50 billion colony-forming units is a good number. The Saccharomyces is a fantastic, yes, it's a yeast, but it's a fantastic benefit. If you go to 3 different health food stores, I guarantee you can find 20 different probiotic preparations. And to me, the key is find one with a wide range of the good germs that it's going to put back into the system. And you're probably going to be doing well there. Treat infections. If you've got, if there's an overgrowth of Clostridium, you may need to treat that particular infection. And Giardia as well. Giardia has pretty much got to be treated. That's not something you can just beef up the immune system and it will go away. It's there until you treat it. Other things to consider. And this impressed me too. These were physicians. All these were physicians, and they know about infections. And they really only used specific antibiotics or specific, like there's one particular medication you use for Giardia. They only used it when they knew they needed to. And typically, if you think about most medications you take for an infection, you're only going to take them for a few weeks. But what we're talking about is we have to change the entire milieu in the gastrointestinal tract. And that may take months to years to get everything in a situation where the good germs are growing and the bad germs aren't. So they were using a lot of naturals because they didn't have to worry about side effects or killing off all the wrong stuff. The naturals tend to work a little more gently, a little bit more gradually. It's just creating a better environment for the good stuff to grow. And things that may have used are garlic, 1 to 2 fresh cloves or pills a day, caprylic acid, oregano oil, oil of oregano. That came up from several different lecturers that they were using that with their patients. Grapefruit seed extract or citrus seed extract, using 1/3 of the adult dose for these children, and then of course the Saccharomyces, 3 to 9 capsules a day. And you don't, as long as the person isn't sensitive to yeast, you really don't have to worry about getting too much of these germs because they reach their own equilibrium. Now, what happens if you do all this and it gets worse? And this is an important concept. I think if there's some people out there who have autistic children or know someone, and you begin to try some of these therapies working with your physician, you may find situations where they get worse for a little while. If you've been in the natural world for very long, you may have heard of something called a healing crisis. Things get worse before they get better. And it won't always happen, but it's something to be aware of. There are a few reasons. Sensitivities. He may be sensitive, he or she may be sensitive to something new that's been instituted. Another thing that can happen is something called die-off. If you are suddenly, there's been an overwhelming overgrowth of something in the intestines, and there have only been thousands of germs activating symptoms, and now you kill them off. Now there's millions to billions of dead germs activating symptoms. The person may actually get worse before they get better. A few clues or things to do. You may be working with someone who suggests, before you begin this probiotic regimen, I want you to have some activated charcoal. Why do you want to have activated charcoal? Because it's going to soak up the toxins that get released when you kill off all these germs. So it can actually help you figure out, the child is suddenly spinning in circles, is turned into a whirling dervish. Well, if you give them the activated charcoal, it may soak up these toxins. Again, do this with under physician's care, but these are things you may be asked to do, and that's why. Now let's look at metabolic dysfunction. Big, long words, but basically what this is saying is that the systems on a molecular level aren't working right. It can't methylate things, and it can't sulfate things. There's increased stress, oxidation. The enzymes aren't working. The normal enzymes, not digestive enzymes, the enzymes in the rest of your body that are supposed to do jobs can't do them. They may be unable to make creatinine. They may be unable to make neurotransmitters. How is your brain supposed to work if you can't make the right neurotransmitters? And they may not be able to break them down properly either. The membranes may not be working properly. They may be faulty. And gene expression may be completely dysregulated. The wrong genes are getting expressed or overexpressed. We'll look at the antioxidant system. Now, antioxidants protect from damage or reverse the damage of oxidation. The easiest, I think, mental image for people for oxidation is if you cut an apple and leave it open to air, the white part of the apple will turn brown. If you smear half of it with lemon juice, that part of the apple will stay white longer. And that's just an example that when it turns brown, that's oxidation. When it stays whiter longer, that's an example of the antioxidants in the lemon juice protecting it from the oxidation. That's the example there. So what you have to understand is that everything in your body is at risk for this oxidative stress, this free radical damage. And this oxidative stress is going to prevent effective methylation, sulfation. The body's not going to be able to make energy for the cells. It's not going to be able to process proteins. There's going to be buildup of toxins. So it affects, the antioxidant system affects the function of every single element in every system in the body. What's at risk for oxidation? Every protein, every enzyme, your DNA. It's a huge. So if the antioxidant system isn't working well, or if it's stressed, there's it's sort of like the foundation to me for a system running well. So we're talking about free radicals. Medications may increase oxidative stress. Tylenol is a perfect example. Your liver has to be totally distracted to break down this Tylenol, and if it runs out of the stuff to do that, something called glutathione, it's suddenly unable to detoxify anything else in the body. Pollution, herbicides, pesticides, preservatives, flavor enhancers, that's code for MSG. MSG is a neurotoxin in and of itself. It probably could do an entire hour lecture on that. Other stressors, injury, trauma, infection, and like I said, the loss of that glutathione is the key antioxidant in the body. So when you've lost it, your body is really crippled. So we'll talk at the same time with antioxidants. I like to talk about detoxification. Again, this happens at the molecular level, but it influences everything that happens in the body. There's something called metallothionein, and that metallo, you should think metal, because one of its job is to carry metals around in the body. And this is metals that may not be dangerous, but also heavy metals. And without the proper amount of zinc, you can't make that enzyme. It takes 7 molecules of zinc to make 1 molecule of this right here. If you've got a deficiency in zinc, you're not going to be able to make it. There's that glutathione is another example of a molecular detoxifier. Superoxide dismutase, a big long word, sorry, we abbreviate that SOD. It's another example that's trying to help detoxify things, and it's particularly an antioxidant. How else do we detoxify things? We excrete them. We may excrete them into the urine, get rid of them in the stool. Again, this is a reason constipation is a problem. You will reabsorb some of these toxins if you're constipated. Excrete them into the hair, sweat, milk, and even the fetus. This is particularly important for mercury. If mom has a lot of mercury, it goes to the fetus. It goes to the fetus. The fetus acts like a sink. I don't know why this happens, but it's actually a magnet for mercury. Other things, ways that we detoxify. Sequestration. What that means is I'm going to just brick it into the wall somewhere, block it off somewhere, so that it's not circulating in the body where it can damage things. And last thing I have to say, a healthy body should be able to process some toxins. And I think one of the problems that we're seeing is we're just not healthy anymore. So the detoxification system in autism spectrum, they've got a high toxin load. The detox system is completely overwhelmed. They've got low zinc and high copper, and the high copper makes the low zinc worse. The low zinc makes the high copper worse. That's a vicious cycle in and of itself. They can't make metallothionein. They may have behavior issues just because of this imbalance. There's high oxidant stress, low antioxidants, low glutathione. Remember, that's your body's key antioxidants there. Low selenium, and again, the constipation. They may be reabsorbing these things. Now, it wouldn't be complete. There was so much information on mercury, and I found it so interesting. I just wanted to share some of it. It's mind-boggling. The ATSDR, I forgot what it stands for, sorry, says that mercury is the most toxic non-radioactive substance in the U.S. The EPA, the Environmental Protection Agency, the Food and Drug Administration, the CDC, and the American Academy of Pediatrics all are advising against eating fish for women who may become pregnant and for children. Why? Because mercury is just that toxic. The EPA says 1 in 10 women have a mercury level high enough to damage the fetus. I'm sorry, CDC said that. And the EPA says 1 in 6 infants today is born with blood levels of mercury high enough to impair neurologic development. That's 1 in 6 infants?
Is that all fish, Elizabeth?
What?
Is that all kinds of fish?
There is more more methylmercury in some fish than others. It all comes down to something called, I want to call it magnification. I just blanked on the exact word. But the idea is mercury is in the water. Little tiny microbes take it in, and they change elemental mercury into ethyl mercury or methylmercury, which is the more toxic, and concentration. It's biomagnification. That's the word. And as smaller fish eat them, that's fine. They just get a little bit of it. But the bigger fish eat the smaller fish, and they actually, that's this biomagnification concept. They actually concentrate it. So your bigger fish, your predator fish, are the ones that are going to have the higher mercury levels. And the lower levels are going to tend to be in smaller fish, anchovies and sardines and things like that. But that's, in general, they're just saying across the board, they're saying we want you to limit your fish intake.
Mm.
And I went ahead and looked. I didn't believe this 1 in 6 infants. I found it on somebody's website, but I thought, well, let me go see what I can find from the EPA's website. This is a document. If you click on this link, you will be led to a document where they give you the incidence of how many infants they think are born with high enough blood mercury levels. It's about 600,000 a year for that year. Then I went to this site and found out what the birth rate was for that year. It was about 4 million children born that year. And you do the math, and it's about 1 in 6 infants. So that was correct. It begs the question, why don't they all, if they all have some mercury, and we know mercury is extremely neurotoxic, why don't they all have impaired neurologic development? Well, first of all, remember, autism is a multiple factor thing. The other thing is we may not be sensitive enough to really be aware of some of these things. So we may not be picking, they may all have some neurologic issues, and we just aren't picking them up. So how does your body detox mercury? What does it do with it? How does it handle it? It uses glutathione and selenium, and it binds it. And so because once it's bound, it isn't going to damage those nerves. Unfortunately, people with autism spectrum disorder have lower levels of both glutathione and selenium. There is impaired elimination through the hair. This was a study. Basically, they took the first baby haircuts of autistic children and compared them to children who weren't autistic, and found that there was much lower levels of mercury in the babies with. So what does this mean? They're not getting rid of it. And the impaired detox systems may mean higher exposures of mercury. What does it do? In the blood, it impairs the synthesis of heme. That's one of the things your body uses to make hemoglobin. It impairs cognitive function even in adults. That's comforting. In anybody who's neurologically challenged is going to make poor diet choices, and they're going to increase the oxidant stress with that. Adults are also at risk for that. The toxicity is going to actually worsen the antioxidant and detoxification systems. And mercury is initially an anti-immune. In other words, it turns the immune system off and tells it not to fight anything. Then it's autoimmune. So this is going to increase that friendly fire situation. This is an interesting study. Someone looked at Texas autism rates by school district and compared them to the environmental load of mercury, or the environmentally released mercury. This is primarily from coal burning. And they found that for every 1,000 pounds of environmentally released mercury, there's a 43% increase in the rate of special education services and a 61% increase in the rate of autism. And I guess you can download the slides and look these sites up yourself. So how do we optimize the detoxification system? Because this is important. You got to optimize glutathione. The bad news is you can't just take a glutathione supplement. We don't absorb it very well. Your body has to actually reconstruct it. In fact, if it's going to be carried inside a cell or something, it's going to actually have to be reconstructed inside the cell. Your body synthesizes it from cysteine, glutamic acid, and glycine. So your choices for really what to supplement, N-acetylcysteine or this SAMe, seem to be the best things for optimizing that. Now, another thing to know, pycnogenol, that's that basically pine bark extract, okay, is going to improve, sorry, all these letters mean the kind of glutathione that's ready to do the job, and the other kind is the kind that's already been spent. One of the things that we know about the people with autism spectrum disorder is they don't have nearly enough that's ready to do the job. It's all spent. So the pycnogenol is something that's going to help support that system also. And you want to optimize your antioxidants. You want to eat foods that are vegetables, that are fresh, whole, raw, and nutrient-dense. And I know you're thinking, good luck. All he eats is, chicken nuggets or something with breading. We're back to the gluten problem again. But that's why I think for so many people it's going to be important to supplement, especially when you know the digestive system is challenged. They may not be absorbing things from the food anyway. So you're going to have to be supplementing some things too. You want to measure nutrient labs like zinc in particular. You want to look for it, and you want to make sure the zinc is optimized. And if you discover that the zinc, you've normalized the zinc level, you normalize the copper, and the metallothionein system seems to be challenged, some people need that system to be optimized. There's a link if you want to check into that for clinicians. So So what are we going to find? High copper, low zinc. I did talk about that a little bit. Low iron, low magnesium, low levels of vitamins A, D, the Bs, the entire B spectrum. There's usually low. The vitamin A is important because it helps balance the Treg system and T effector. I should explain that just a little bit. That's two different arms of the system that's sort of a come and fight versus the stand down kind of a situation. Vitamin A can help eliminate chronic measles for those people that didn't mount the proper immune response. It may just be a vitamin A situation. You optimize the vitamin A, and they're able to get past it. Low selenium, they have low taurine. They may have high. These are more allergens. This IgE is sort of like an environmental allergen, whether it's a pollen or food. High methylmalonic acid, and that gives us a clue that there's low B12. So all those things can be optimized as well. I mean, the B12, they may even require injections. It works a lot better than just taking an oral supplement. Again, see, they're not absorbing things very well, so you may have to use injections to supplement some things. Mitochondrial system. Now, the mitochondria is like this little energy factory that lives in every cell, and it basically is responsible for the energy that gets produced in a cell for the cell to work. It produces free radicals. It basically, they sort of leak out of it, and it relies on glutathione to protect it against oxidative stress. Oh yeah, bad news. The kids with the autism don't have enough of the functional glutathione, so that's already challenged. Now, there are mitochondrial diseases that are basically inborn, but there are still people that have impaired function, and that can be optimized. And the most affected tissues are going to be the ones that use the most energy: the brain, the nervous system, the heart, the muscles. Those are going to be the most affected if that mitochondrial system isn't working well. The toxins to the mitochondria include heavy metals, mercury, there it is again, lead, arsenic, cadmium, aluminum, and they're everywhere. They're everywhere. Pesticides, diesel exhaust, another mitochondrial exhaust, toxin, and even propionic acid from Clostridium. Now, Clostridium is one of these germs that lives in your intestinal tract, and there's not enough of it to cause any problem. It actually helps ferment certain fiber constituents, so you can make this stuff, which is actually nutritious. It's nutrition for your large intestine. So that's a good thing. The problem is if there's a lot of this and a lot of this, a lot of propionic acid, and a lot of leaky gut, and this is being absorbed into the system, this is going to have a toxic effect on mitochondria. There was an interesting study. They gave basically injected propionic acid into, I believe this was a mice study, and again, they got these abnormal behaviors that that were eerily similar to autism. Now, is this what's happening all the time? No, there are multiple factors. So that's why you have to have an astute parent, astute clinician, and a willingness to find everything that may be contributing and address that. Associated signs and symptoms with mitochondrial problems: developmental delay, low muscle tone, constipation, or the GI dysmotility. It means things may spend too long in the intestinal tract, and that may alter with diarrhea. Slow cognition, fatigue, seizures, and other oxidative stress. So what do we know about mitochondrial dysfunction in autism? It's common. It's common enough to look for it in the kids who have a high lactic acid level. And the reason there's probably an association, lactic acid is a byproduct of anaerobic metabolism, and as that's building up, what that's telling us is that there's not enough aerobic metabolism. Hey, maybe there's something wrong with the mitochondria. So in one study, they looked and found that 17% of the kids with autism had a high lactic acid level, and 35% of them had mitochondrial dysfunction on a muscle biopsy. Another one found 20% with a high lactic acid, and among those, there was a high percentage with mitochondrial dysfunction, but it turned out to be about 7% of the total with autism spectrum had a mitochondrial dysfunction. So it's worth thinking about. How do we support the function of that? Well, antioxidants. You may have heard of coenzyme Q10 or CoQ10. Very important. The carnitine. Carnitine is what actually allows the mitochondria to move the energy building blocks in and out. The B vitamins, thiamine, B1, pyridoxine, B6, riboflavin, B2, all very important for the mitochondria to work. Pantothenic acid, B5, some people call it B5, also very important. Vitamin E, another antioxidant. You've got to help reduce the oxidative stress. Vitamin C, also another antioxidant. Alpha-lipoic acid is going to help the mitochondria. Thing to know, if you've got someone with yeast issues, it may make the yeast worse. Vitamin K, folate, creatinine, and B12. And again, if this is someone that's really challenged, you may find that injections are the smartest first way to go. Also, selenium, succinate, and ginkgo may be helpful for the mitochondria too. We've got D-ribose, antioxidants, and then there are these sort of iffy things. Chelation. Chelation is a situation where you know there's high levels of heavy metals, say mercury or lead, and you actually give a therapy that's just for that heavy metal to help grab onto it and take it out of the body. And honestly, it's controversial. It's controversial whether we're talking about autism or heart disease or anything else. Chelation is somewhat controversial unless you've got someone who has a clear-cut acute toxicity and a toxic syndrome associated with an acute exposure. It's not very controversial then. But in kids with autism, I think there's a wide variance of opinion there. Hyperbaric oxygen, like I said, what this does is kill off the old mitochondria, but new ones will form, and the new ones work better. So that's important to know. It also helps build up that SOD, that antioxidant, superoxide dismutase. Another thing that may be helpful, cholesterol. This blew my mind. There are kids walking around, particularly with autism, they may have a cholesterol level of 80, and your brain has a lot of cholesterol in it. It can't be expected to work properly with a cholesterol level of 80. One of the things that one of the vendors had, probably more than one, I just noticed it was one, you could buy cholesterol supplements. I thought, wow.
That's new.
Yeah, that was a new one on me. So you may be able to get them to eat eggs, or if they're allergic to eggs or won't eat eggs, then you may be giving cholesterol supplements if you've got someone with a low cholesterol level. They had fewer autistic, in a study, they had fewer autistic behaviors, fewer infections, symptoms of irritability, hyperactivity. There was less aggression. There was less self-injury. But you have to know, is the child you're dealing with, does he have a low cholesterol? So it's worth checking, and it's worth intervening if you find a very low level. So in general, we're coming down the home stretch here. In general, you want to replenish what's missing. I mentioned the vitamin D. It's extremely important. It impacts almost every system in the body. This is one of the shepherds that actually helps turn on and turn off genes in the human genome, and it's extremely important at doing that. It's not really a vitamin; it's a pro-hormone, and as common as deficiencies are, and as easy as they are to treat, I think this should be one of the first things we do for people with issues. Magnesium and B6, very important. In fact, all the B vitamins, 1, 2, and 3 are important for methylation. They're important for energy production. B12 you've got to have for your nerves to work correctly. You can't make myelin. That's that nerve coating without B12. So all these things are important. Folate, vitamin C, A and E, essential fatty acids, omega-3 fatty acids. Now, I should specify that when in autism, they're not just missing omega-3. They're missing omega-6 fatty acids too. Most of us who have these chronic degenerative diseases of Western life, like heart disease and things like that, we actually have an imbalance. We have too much omega-6 fatty acid and not enough omega-3. These kids need it all. They need all of it. So don't hold back. And then anti-glutamates. Again, we talked about last week how glutamates may inappropriately stimulate the neural net. And so what you want to do is turn down that stimulation. so that only the appropriate messages get through. So things like pycnogenol, that's the pine bark extract, chamomile, taurine is another important one, and GABA. We want to repair. Some kids may need immunoglobulins. They may need immunotherapy. Some are going to need phosphatidylcholine, which turns down that inflammatory response. Melatonin, another great antioxidants, anti-inflammatory, really nice for a lot of parents. It promotes sleep. If you can get a parent 6 or 8 hours sleep, that you've made a friend, and it can be very helpful there. And again, detox, question chelation, you do want to measure the heavy metal levels, and you want to make sure you're moving in the right direction. But as you are improving the way the body is functioning, the way the detox systems are functioning, you may find that, chelation is something you don't need to do. You may be able to let the body do it on its own. Glutathione, selenium are going to help detox. Sweat may be something else to consider. And then, like I said, chelators are a bit controversial. So now, here's my punchline. Why the epidemics? In my opinion, I don't think we're just getting more accurate with finding them. I think these kids are the canary in the coal mine. What they're telling us is that our current paradigm of eating whatever we want and poisoning our bodies on a ritualistic basis is probably not going to work. This is not good for us in the long term. And the most, I think, impressive information I got was how like I say, the moms typically aren't normal. These kids have been stressed from before birth. And, when we learn that, we have to think about, well, not just what are the autistic kids going through, but if mom's going to have another kid, what is she doing to take care of herself and getting herself detoxed before she does that? For those of us who don't, or, anyone who doesn't have children yet, there was one slide that specifically showed an association with the number of mercury amalgams that mom had with the incidence of autism in the kid. So, does that, that's only one study. Does that make it true? No, but it gave me pause for thought of, what sort of a toxic load am I carrying around? Our antioxidant and detoxification systems are overwhelmed. We can get away with it because we're adults, but our kids are suffering from it. We've got nutrient imbalances. We've made, maybe not everybody out there. This is a sophisticated audience, okay, but most of us have made some probably poor lifestyle choices during our lives. We're failing to exercise. We're eating things that are going to be preserved until the year 2020, and that can't be good. What's the nutritive value in that? If you've got flour that's enriched, it had, what that means is they took all the nutrients out of it, and then we only put back the nutrients that we thought were important. So we're missing it. We're missing it when it comes to eating some of the things that we eat. And like I said, our systems are overwhelmed. And that's what I gather. I don't blame it on the ozone, although that may be a problem. I think our entire systems are overwhelmed. A couple of resources. I want to go through these. Please, you owe it to yourself. If you haven't been to the Autism Research Institute site, you owe it to yourself to give yourself another dose of hope. Please go to the Defeat Autism Now site and find out when the next conference is. And I've left my paper downstairs. I believe it's in Dallas. I believe the next one is in Dallas. If you can actually go onto this site and find a practitioner near you who has been through this Defeat Autism Now course. Now, it's not an official certification, but at least they've been exposed to the information. Obviously, the Autism Research Institute can't guarantee any level of practice, but at least you're dealing with somebody that's been exposed to the information. I like to put a personal plug in for my favorite site. I've evaluated this site myself, met the physicians and all the practitioners there. They do an outstanding job. If I did it, I would do it there, and I would do it their way. So this is a fantastic Pfeiffer Treatment Center. It's in Warrenville, Illinois. There's also another one in Oakdale, Minnesota. You can go to this site, hriptc.org. They basically evaluate the total person. They treat every person like an individual, and they are checking for these imbalances, for these overgrowths of germs, everything that I've talked about, and then they come up with a protocol for that person and that person only. And I've been really, really blown away by what they're doing. If you're new to the whole concept of autism and would just like, a little bit more basic explanation, Jenny McCarthy has done a pretty good job in Louder Than Words. She tells her own personal experience of how her son developed autism and basically her story just all the way through. And, and there's a happy ending. He is now, they call it losing the diagnosis, and I thought, well, is that bad or is that good? No. What that means is they used to be considered autistic, and now they're not, and that's very good. They didn't lose anything good. they got rid of the bad diagnosis. So, and those are just resources that I wanted to share with you. Okay, that's it.
Are you up for a few questions?
Sure.
That was.
I talked everybody's ear off. I'm sorry, guys.
Well, that was great information, Elizabeth, and we had lots of people typing in, is this going to be recorded, and things like that. So you can tell people we're finding great value in the information. And yes, we do record it and put it either in the online store section of our website or it's in the free area for our members. And if you have any questions about that, you can email us. Okay. Unfortunately, Dr. Dolan had to leave.
Well, you know what? Hello, I'm still here.
Oh, you are still here. Great.
I have 15 minutes before I leave, but I have a slew of questions for you. I don't want to hog the questions, but I have some that could probably be quickly answered. First of all, thank you so much for this comprehensive summary of everything. I think that's really great for the listeners. My first question is, the gut study that you mentioned was exceedingly small, 36 children, so, I really question the significance of, 69% of gastritis or 47% of something else. It's so small. I was just wondering, are there any sizable studies that are ongoing or planned to really look at gut issues in autistic children?
I don't know about ongoing, I can't speak for the Autism Research Institute, and I don't know what studies are planned, but just to me, when you please, and like I say, that just the Defeat Autism Now lectures, there were 2 days of lectures, intensive clinical information. So this is just like an hors d'oeuvre. This is like a tapas platter, okay?
Okay, because when I last, really researched it, there were still just a few studies done by Dr. Wakefield and not much else. Now maybe there's more, quite recently, but again, this might be something that has to be looked at over a longer term.
Oh, I'm sure. And there's, excuse me, there's probably never going to be enough research. I mean, it's always going to be the problem. And when autism was, 1 in 400, it was even harder to get a study together. So it's more frequent now, and at least we've got more things to look at. So I agree, that's always going to be a problem. I mean, you're not going to have an autism study of 10,000 patients. I mean, you just,
of course,
it's
that's something more than 36. My next question is since there's so much basic brain formation that happens in utero and within the first couple of years of life, is most of the brain damage in autism done long before the patient and the doctor decide to get around to trying and finding out about it, trying some of these therapies? I mean, I hear what you're saying about Jenny McCarthy's success story, but how common is that, and what is the current feeling of how much of this is already damage done?
So I guess the question is, how do we know whether the damage is reversible? Is that what it comes down to?
Right.
Okay. I don't have specific incidences for you, but I know that if we don't try, then we'll get nowhere. So I can't, and that's why I said very early on, none of this is a magic wand. There's no guarantee, and we don't know what's reversible, what's not reversible. But what I have learned about the human body is that it has fantastic ability to heal itself given the proper tools. And what started me, I didn't get to tell much of my story at the beginning, what started me sort of down this road to natural health and looking at non-pharmaceuticals whenever possible was doing research for my mentor in pediatric surgery. He told me to look for the answer to a question, but what I kept tripping over was all this information in the medical literature right there about how people were getting better from situations I had been taught they would be stuck with forever. So like arthritis, there are people that are actually may have improvement in the actual, joint abnormalities and effusion and problems from arthritis. And I was basically taught, well, it's a downhill slope until you get a knee replacement or high blood pressure. So I'd never doubt the body. I always give the body the benefit of the doubt. And if there's a chance that someone can get better, I think it's worth taking the chance. So that's my approach.
Excellent, excellent. What a great hope for parents. My next question is, since most clinicians, pediatricians, and family doctors that parents are going to are clueless about most of these possible treatment modalities.
That's for sure.
How is a parent to find a good practitioner? That was actually a question I wrote to Sherry, and you did give part of the answer actually in the Defeat Autism Now, giving a list of people who've gone through their course. But I was wondering, in some locales, does this always have to be an MD or a DO, or is a nutritionist sometimes the best choice in certain areas?
Oh, I think absolutely you're going to find a lot of benefit there. If again, in that Defeat Autism Now is open to all sorts of clinicians and parents, and so it's a wonderful place to start. And there were nutritionists there when I was there. I was delighted to see it. So I think your point is very well taken, especially in some areas where, like you said, everybody's clueless except the nutritionist.
It's slim pickings. A couple other questions. What are some sources of non-plant, in other words, non-yeast enzymes? You mentioned if there is a yeast or gluten sensitivity. And then I guess I have another question on that. The gluten comes from wheat. Of course, most wheat products also have yeast in them. So these are two separate issues that I think sometimes get confused. But if there is a yeast overgrowth or yeast sensitivity problem, what are some sources of, quote, non-plant enzymes?
Well, the non-yeast enzyme, the more raw food you're eating, the higher natural enzyme content is going to have. For example, bromelain comes from from pineapple. We've got the papaya enzymes. If you're eating raw vegetables, they're going to have their own enzymes sort of present within them. I didn't even get into fermented food, but the fermented foods tend to have already had some enzymatic action on them, so they're easier on the body. And those are, I think those are options. Not everybody is yeast sensitive, so at least fortunately that's something I think when we're talking about the plant enzymes, most people are going to do okay. I just think we have to be aware if they are yeast sensitive, you're going to have to fall back on your fresh raw vegetables.
Right.
Even if you have to juice it,
Right, get it from the natural source. My other question has to do with the infections that you mentioned, the possible systemic or gut infections, Lyme disease, parasites, strep, or Clostridium. Of course, one theory is that some 20% of school-age children just are colonized with strep. So how do you identify, just because you have a positive strep test or a positive Lyme antibody test, that there's some sort of active infection going on versus, they met the Lyme bug one time in the past and they made antibodies to it, no big deal. And it is a big deal because the conventional treatment for latent Lyme disease is months of antibiotics, which doesn't sound like it's a real good idea for these kids.
No, and that's why you've got to have a clinician that's going to, that's why I put in a plug for the Pfeiffer Treatment Center. You don't really, I think if your kid has autism, you don't want somebody that does autism part-time. You want somebody that does, that's what they do and that's what they know. So, and I recognize that's not always possible, but so I think here's some clues. If you've got somebody that's obviously got, say they've got recurrent strep or they've developed PANDAS, that's pediatric autoimmune neuropsychiatric disorder associated with strep, okay?
Right.
So you've made this association. That's somebody that you're going to have to take the strep very seriously. And they're putting these kids on bicillin, okay? Because that's what they're needing to help fend off that strep infection. Some of the kids need it. Rectal strep, these are, like I said, the bloody stool. And this may be, say, the 3 to 5-year-old age group. And it's clear. It's a significant amount of blood. It's not a rectal fissure, okay? It's a significant amount of blood. And, you get a 4+ strep back on that one. Okay, that's an active infection. You've got to do something with that. But sure, you're going to, if you just culture stool, you may get a certain amount of strep. You know.
Right.
So I think you have to treat the patient, not the lab.
Well, that is one of the concerns I feel for the consumer, because there are now any number of different kinds of practitioners that you can go to that will offer you a variety of lab tests, and it has to do with, okay, what's the significance of the positive lab test, and so you're getting it interpreted either by the lab or by a practitioner who maybe doesn't have the whole view there, so it can be treacherous. I had one question about some of the treatments you mentioned. Some of them look like they can increase, for instance, IgA antibody in the gut, or it can increase something like tumor necrosis factor. What is the influence of that on autism, if we base autism on an autoimmune theory? Like, are we sort of trying to play God here by, well, let's increase these immune factors that actually I could see could sort of work against the system if the theory holds that this is an autoimmune problem? Well,
I'll go back to what I said at first. I don't think it's just an autoimmune problem. I think everything is messed up. I think there are multiple systems working against each other. And if I gave the impression that I think it's just autoimmune, then I misspoke. The immune system, I gave a little overview so the lay audience could understand some of what I was talking about. But it's incredibly complicated. They spent an entire 2-hour lecture on the immune system, and what I learned in medical school is completely obsolete. I learned there's cellular and humoral. No, there's innate and adaptive, and there's TH1 and TH2 and all these different things. So I definitely oversimplified it.
No, I didn't mean to imply that you said it was all immune, but that certainly seems like a lot of these treatments are based on that angle of theory there. And
oh, okay. Well, and then what I'd say, one of the things I guess I didn't make a big point about is two arms seem to be increased, the TH1 and TH2, but they don't have that stand-down order. That IL-10 is not significant. It's not doing anything. And the treatments that I mentioned, I don't think I would have said increased tumor necrosis factor, but actually decrease it. They increase the IL-10 so the body isn't sending out all these random fight orders that have the immune system so confused it can't even mount an appropriate response to a vaccine, or even can't even appropriately fight a foreign invader. So
I got it.
I don't think it's just I don't think it's just one thing. We're trying to support the whole body getting all better all at once.
Well, I think it's really good for parents to have these resources here. I just really wanted to add another one that I came across that was tremendously interesting to me when, of course, I was trying to look at what are the causes, what are the statistics, but really, what parents are interested, okay, already, what is the treatment? There's an organization called Thoughtful House. I don't know if you're familiar with it, thoughtfulhouse.org. I believe they're based in the Southwest in the Arizona area. But it can be found on the web at thoughtfulhouse.org, and it's a great multidisciplinary approach to treating autism, staffed by doctors, and the first thing they say is it can be treated, your child can get better. So it's a lot of hope for the parents, and they are getting some results. Yeah.
Terrific, definitely. I'm definitely pro-hope. I was very conservative when I got into started interacting with people in the alternative, looking at herbs and vitamins and nutritionals and things like that. I was very conservative. Really withheld. I thought giving false hope was the worst thing in the world. And when I saw how well people tended to respond, I mean, people were singing my praises and dancing in the street. I said, this never happens in clinic. I've never gotten this kind of response from just writing a prescription for something. It really changed my outlook. And now I think it's wrong to withhold hope, because I've learned that there's hope for almost any situation.
Exactly. Well, that's all of my questions. I guess I'll let somebody else in here. And
well, thank you so much. I appreciate it. I'm honored you're here.
Yes, and I think it was very informative, but I'll back off now and leave room for other people to ask questions. But thank you very much, Dr. Owings.
Thank you, Dr. Dolan.
Thank you. If you do have a question, you can type it in. We've really only had a few come in, and most of them were encompassed a lot with the ones that Dr. Dolan asked.
Oh, okay.
Let's see. Here's a question. With mercury fillings, is it worth taking them out? Is mercury still being released in the body?
Yeah, the evidence is that mercury is in fact being released in the body. I think if you are fairly normal and fairly healthy and your brain is working okay and you have, had a hysterectomy or you're a man, no, it's probably not, paramount importance to get the mercury out. However, if you've got autoimmune problems, that can be an association with the mercury. If you've got if you're planning to have children, and say, for example, you already have a child that's autistic and you're planning to have more children, it may be worth it for you to have the mercury removed. You need to go to a dentist that actually specializes in that knows what they're doing, that's going to protect you. You need to take a large dose of antioxidants before you go in to have them removed. And you have to understand that the dentist actually has to treat this like a toxic waste when it comes out of your body, because your body's converted whatever elemental mercury was there. It's probably converted it to ethyl or methyl mercury. So they have to treat it like it's a toxic substance coming out, and I think it is worth it. I think it is worth it if you fall into one of those categories.
And if people want additional information about that whole topic, we did a webinar a couple of weeks ago with Dr. Edgar Luna called What Affects Your Mouth Affects Your Body. So if people want to learn more about that, they could go check out that recording. At the beginning, somebody typed in the Saccharomyces, and they spelled it S.
Saccharomyces.
Okay.
Yeah.
They were wondering, the people who were eating that, if that was just like eating sugar. Is that a sugar?
No. It is a yeast. It's a germ, but it's not the kind of yeast that causes infections. Like Candida is a yeast that causes infections. We all carry a little bit of it around, and when it gets an advantage, like you take antibiotics, then it rears its ugly head and causes a yeast overgrowth. The Saccharomyces does not cause an overgrowth, but it helps produce lots of things that are good for the gut and good for the immune system, and it helps fight off some of the germs that can cause problems.
Okay, thank you.
Does that help?
Yes. Let's see. Somebody wondered if they're mentioning a book. It's called Thoughtful House. Is in Austin, Texas, and a doctor named Dr. Brian Jepson. He wrote a book called Changing the Course of Autism. Just something somebody's recommending from Dr. Jepson at Thoughtful House.
Great.
Another resource. Let's see. All right, one last comment that somebody else typed in.
Are you there?
Yep, I'm here. Are you there?
I'm here.
Okay. This is just one last comment that one of our listeners typed in, and then I think we'll wrap it up. It says, having practiced a lot of what you have said here with good results over 15 years, I would additionally stop fluoridated water for baby drinking and fluoride toothpaste.
Yeah, the fluoride and the chlorine, all, again, those are toxins. They're going to promote that free radical damage. And you remember I mentioned at the very beginning, there may be, this is a complete lifestyle change, and the people that are getting the best results are just changing almost everything they're doing. I'm sure getting rid of fluoride is one of the, that may be a key. And remember, I mentioned the person with a swimming pool. They switched from a chlorine disinfectant to saline, and one child in particular that I heard about had a dramatic improvement. So these are all, you're right, definitely chlorine, fluoride. You want to get rid of these things.
Okay. Well, thank you again so much for this presentation, Elizabeth, and especially for how much hope I feel like it brought to people that were listening tonight. So thank you.
Good. I'm very happy I could help. I guess I better give you the screen back. Did you take the screen back?
I can take it back when I need to, so we're good. So again, thank you everyone for joining us tonight, and just a reminder to join us next Tuesday night when Dr. David's going to do a presentation called Words, How They Affect Our Lives. You don't want to miss that. So with that, we'll just sign off. God bless. Have a wonderful evening.
Thank
Good night.
you. Good night.